We we really appreciate your time here today to understand a little bit more about switching between GLP-1 medication. We do understand that many people have switched from Mounjaro to Wegovy, and for a lot of people, this did come out of the blue due to the price increases that were put on all of everybody from the manufacturer. So throughout that process, we understand there have been lots of questions from people to understand what are the expectations of this switch, how am I feeling, how is my body adjusting. So at SheMed, we want you to know that we are listening and we're here to treat every single one of you as an individual and ensure that we're able to answer those questions. Our objective is always to be caring and to think of the individual at the center of everything that we do. And we want to ensure that we're keeping you in the best care and the best health possible. So today's session is really designed to give you some clarity and also some reassurance around how your body is adjusting, understand exactly what is happening when you switch from Mounjaro to Wegovy, why that journey can feel different, and it may feel different for every individual as well. And also why is patience so important? So we're going to take you through the science, the expectations, some of the challenges that you may experience, and also some practical tools and tips that hopefully will help you stay on track. We are going to do a little bit of explanation and we're going to do our best to try and keep this as simple as possible and hopefully help you to kind of navigate that process with confidence. So really the goal is simple. It's to keep you informed, to reassure you, and generally to make sure that you are supported on this treatment journey. So first of all, I'm going to hand over to Dr. Matt Noble, who is going to start the conversation this afternoon about the most common experiences after switching.
Thanks, Rachel. So I think it's important to say that switching any medication is pretty much always going to lead to some sort of change within the body, and you would expect that. That's due to a combination of different factors that are all going on all at once. You've got the level of the medication that you're stopping gradually creeping down, and you've got the level of the medication you're starting gradually building up. And then, of course, there may be the differences themselves between the two medications. When we think about medications and what they're doing within the body, we think in terms of things called half-lives. Now, a half-life is defined as the amount of time that it takes for your body to break down 50% of the last dose of the medication you took. Because it's a curve and because it's coming down gradually, we talk in terms of these half-lives to give us an idea of roughly how long it takes for a medication to come out of your system and a medication to come into your system the other way. For both Wegovy and Mounjaro, the half-life is about 5 weeks. What that means in practical terms is that it can take 5 to 6 weeks for the effect of the previous dose of Mounjaro to wear off, and about 5 to 6 weeks for the new dose of Wegovy to build up within the body. So we can expect it to take about that long, 5 to 6 weeks, before we start to see any differences at all, really, between the two medications. Any changes that we're seeing in the 5 to 6 week period are probably just due to the switchover period for the average person. Patience is, of course, the name of the game during this period, as there really isn't any way to speed that process up. It's due to the way that our bodies break down and build up the various drugs in the system. Rachel, are there any differences that we've noticed or that are out there in terms of the side effects for Mounjaro and Wegovy?
Yeah, so in trials, both medications were very similar in terms of side effects. Both Mounjaro and Wegovy are associated mainly with gastrointestinal side effects. Usually these are mild and do settle down over time. There has been the case for our study population, and we've really seen this when we've looked at kind of data and all of our patients as well. We've not really seen any major differences between these medications. The number of our members actually experiencing side effects on Wegovy actually seems to be slightly lower than when they're on Mounjaro, so about 17% versus 22% of when people were on Mounjaro. And we have actually seen a slight difference in the balance of the side effects between those two medications. So for instance, constipation seems to be a little bit more common with Wegovy, but nausea seems to be a little bit less common. So really, there's been no significant differences in the severity of the symptoms between those two medications. And actually, 96% of our members reported these as mild or moderate, the side effects with the severity, regardless of which medication they were taking. So actually, yeah, really simple answer is it's all pretty similar and not much different. So, Dr. Matt, how does your body adjust when switching? Can you talk to us a little bit about this?
Yeah, absolutely. So we talked about earlier on the process of adjusting to that new medication because of the half-life takes around 5 to 6 weeks for an average person. Now, during that time, the body is adjusting to the decrease in one medication and the increase in the other. Now, these medications, both Wegovy and Mounjaro, are of course quite complex medications. They've got a multitude of different effects upon the body. So it is entirely normal to see some changes during that period. It's important to say as well that we have to overlay on top of that the fact that it's undoubtedly a bit of an anxious time for many of us. Switching a medication we might be familiar with to something which we've got less experience of. And it's easy to see why we might then experience some changes in hunger, food noise, or appetite during that period. But by 5 to 6 weeks, the changeover period and that switchover should be complete, and the level of the Wegovy, the new medication, will be at a steady state. So it's only really at that point we can start to think about whether there is a difference that we're experiencing between the medications for us individually. And it's only really after that 5 to 6 weeks that we can start the process of optimizing and adjusting the dose to get the progress back to where it was. The big question, of course, that we want to know is, will my weight loss slow down? We've gathered a bit of data on that. The interesting thing is there's not a huge amount of data out there, and actually, as a result of all of the SheMed members and those people who've joined our study agreeing to give us their data, we're able to put a lot of data out there that just isn't there at the moment. So I'll share a little bit of what we're seeing at the moment. So this is obviously still data that we are working on and thinking about, but might help to understand why we might feel that weight loss is slowing down. So from the data that we've gathered so far, the answer to that question really depends on where members were in their journey when they switched. Those people are at an early stage, those on the lower Mounjaro doses, maybe up to 7.5 milligrams, did see on average a temporary slowing in weight loss during that first month. For example, people that were quite early on in their journey, just on a 5 milligram of Mounjaro, may have been going from an average of losing about 0.6 kilograms a week. Once they switched over to Wegovy in that first month, they lost around 0.3 kilograms per week, so a slowing down in their progress. Interestingly, though, once those doses were increased during months 2 and 3, once they got used to the new medication, those weight loss rates recovered quickly and went back to what they were seeing before early in their journey on Mounjaro. So that's those people on early in their journey on the lower doses of Mounjaro. The really interesting bit of data that we're seeing is that those people who are much more established in their journey, perhaps that were on 10 milligrams or more of Mounjaro, saw a very, very minimal change in their rate of weight loss on average. So, for example, people switching from 10 or 12.5 milligrams of Mounjaro maintained virtually the same rate of weight loss. So before the change on Mounjaro, on average, that group were losing 0.38 kilograms per week. We switched them over to Wegovy and they're losing around 0.39 kilograms per week afterwards. Now, some of that is to be expected. When you are early on in your weight loss journey, the trajectory of weight loss is quite steep. We all know from starting these drugs that we lose most of the weight in those first few months. That then slows down and gradually the curve kind of flattens out a little bit as we go later on in the weight loss journey. So interrupting that journey, switching to a new medication, giving ourselves 5 to 6 weeks to adjust levels early on in the journey leads to a slight slowing down, much more so than it does later on in the journey when things are much more established and that weight loss curve is a little bit more shallow. We'll explore that a little bit in a minute. Rachel, do you want to go into that a little bit more detail, in fact, about why that weight loss would start to slow down?
Yeah, so absolutely. So weight loss, as Dr. Mountain just said, does slow down. But the thing to remember here is this is temporarily slowing down and we will get that momentum back. So the reason this is happening is something that we call and can recognize as a pharmacological gap in the medication. So this is a period where your previous medication is weaning off, but your new medication hasn't yet reached its full effectiveness. So I'm just going to talk you through essentially what's happening here beneath the surface. So firstly, I think the thing to remember is these medications do work differently. So you've got Mounjaro tirzepatide, which is a dual agonist, and it acts on two receptors, the GLP-1 and the GIP receptors. This dual action provides strong appetite control for lots of people. Now, Wegovy, by comparison, is a single action GLP-1. It is powerful and it is effective, but it doesn't activate the GIP pathway. So when you switch, your brain perceives a different and initially weaker hormone signal. However, this won't continue, and it doesn't mean that Wegovy won't work. It just means it works differently and it's more progressive, and we need to build up that medication. So while Mounjaro is clearing, you have to think that Mounjaro is building in our systems. So it takes typically 3-4 weeks for most of that medication of Mounjaro to completely leave our system. And it can take, as we've already discussed, around 5-6 weeks for that Wegovy then to build up to steady levels. So during this overlap, appetite regulation can temporarily dip because one medication is weaning off before the next one is being fully active. This gap is the most common reason why we may see this weight loss slow down. So, as we already mentioned, there is no official dose equivalence between Mounjaro and Wegovy. And even at the closest clinically appropriate starting dose, Wegovy will feel slightly milder until it's titrated up. Now, this isn't underdosing at all. This is just us switching in the most safe and appropriate way to ensure that you feel well during this journey. So most people will see the strongest appetite suppression on Wegovy at those higher doses. So this could be 1 milligram for people. This might be 1.7 or 2.4. But to avoid side effects, we just need to gradually increase those doses and you to adjust to that medication before you can really get this full impact. So the thing to say is it takes time. During the earlier doses, you may not have so much suppression, but actually as we go on and the body recalibrates, actually you will adjust and it will return back to the momentum that we had. So it is normal physiology that this is happening with the medication switches. It is not a sign that the switch between the medication hasn't worked. And the thing that we said, and just remember, is this is expected, but it is temporary and it's not a permanent change. So if we then, I'll just pass back over to you, Dr. Noble, around switching and if it can cause weight regain.
So the first thing to say is that everyone's journey is different. What we're looking at is averages, and there may be some people who have a slightly different experience. But from the data that we've gathered, certainly this seems really uncommon. On average, people do continue to lose weight during that switchover, wherever they are in their journey, albeit at a slightly slower pace for that first 5 to 6 weeks, particularly if they were quite early on in their journey when they were switched across. This, of course, is an ideal time to then focus on other strategies to maintain that healthy weight. The diet rich in protein and fiber, regular weight-bearing exercise, and so on. Rachel, we've got a question in here that came from someone. How do I know if the dose I've switched to is right for me?
Sorry, just finding the unmute button.
Sorry.
So when doing the actual switchover, the main thing that we want to concentrate on is safety. We know that weight loss may slow down, as we've already mentioned, for those 5 to 6 weeks, whatever we do in terms of dose, as the body adjusts and we build up that medication. So the important thing to do here is to switch across at a dose that limits the side effects whilst maintains as much momentum as we can. So after that first month, we know that we can start adjusting the dose to ensure that we find the right one that is correct for you as the individual. Encouragingly, though, as we mentioned from our data, we have seen that when we do this, we see the weight loss trajectory returning to the previous levels by 2 to 3 months. So, and we'll just hand back over to what can I expect from my appetite or cravings to change when I'm switching?
So appetite and cravings are, of course, quite complex pathways within the body affected by many different factors. we know that there are basically three different drivers of appetite and what some might term food noise. There's the physiological bit, the bit that's due to our stomach stretching and feeling full. There's the hormonal part of appetite, and that's driven by other hormones within the body. The body works at all times in balance to try and keep us at a steady weight. And then there's the psychological, the bit from our brain and our emotions, the bit of the kind of brain overlay on top of everything. GLP-1 medications work primarily on those physiological pathways, as many of us will know. It stimulates the same receptors as when our stomachs are full. They do also have effects on the other pathways, but these effects definitely do vary from person to person. So as the body gets used to a new GLP-1 drug and the level of the previous one falls, there might be shifts in which parts of these three pathways are being suppressed, and therefore changes in our appetites or cravings. And of course, as we said, we can't ignore that psychological overlay, that psychological part of hunger. Understandably, it's a bit of an anxious time when we're switching over. If we're worried about our hunger or food noise returning, sometimes that anxiety itself can be enough to actually stimulate that pathway in the brain more and even increase the food noise a bit further. All of these things together then that we may experience some changes, particularly during that initial 5 to 6 week period, and for some people up to 2 or 3 months as we adjust the dose for the right one for them. But again, for the vast majority of people, this does appear to settle back down once you're at a steady state of the Wegovy. Another question we had was, if I switch to Wegovy, can I ever switch back to Manjaro? On this, I'd say that deciding Wegovy isn't working for you, before you do so, it's well worth making sure you've given it enough time. We've talked again and again about this kind of 5 to 6 week period, and then the period of a few medication cycles after that to make sure the dose is optimized for you. Giving that dose a chance to reach that steady state within the body before making any decisions is probably a good idea. But if you're still feeling like Manjaro is better for you after this period of time, then in theory, there's nothing preventing someone from switching back if they want. But there are a few things to bear in mind. Firstly, that 5 to 6 week crossover period that we talked about applies the other way as well. So there will then be another period of your body adjusting between medications, regardless if that was a Manjaro to Wegovy switch or a Wegovy back onto Manjaro switch. Again, we've got that adjustment period. The other thing to bear in mind is that it really isn't a good idea at all to switch to anything above a 5 mg starting dose of Manjaro if you're switching back. Manjaro, as we know, is both a GLP-1 and a GIP drug, and so starting Manjaro at a higher dose than 5, even if you've been on another GLP-1 such as Wegovy, is highly likely to lead to some pretty horrible side effects due to that GIP part. And so if you are thinking about switching back, it's definitely worth doing so with the support and advice of your clinician. So Rachel, with all that being said, how can we optimize our results when we are switching?
Great, thanks. Yeah, and I think this is a really important subject to think about. So while your medication levels are adjusting, is actually the perfect time to ensure that you are making those changes to your lifestyle, seeing what you have done over the past few months or 12 months, has that made a difference? And actually really trying to listen to your body and really build those good routines, making sure we are making a difference to our appetite, looking at our dietary behaviors and exercise. Now, there are a few areas that I would say matter most, and it's probably worth thinking about. So, firstly, protein. We tried to speak about this and around building your plate around protein. So, protein is one of the most powerful food tools that you can have during this adjustment period. It really will help you to steady your appetite, it will keep you fully for longer, and it will really support that muscle as well as stabilizing blood sugar. Um, this alone, though, can dramatically reduce your hunger while Wegovy is building up, or like we said, if you had chosen to go back, actually any of those medications building back up again. The other thing we can do is eat frequently. So, eating every 3 to 4 hours. One of the most common experiences during the switch is people saying that they're hungry or they're getting this food noise back that we've mentioned already. So, eating regularly, small meals, and making sure they're protein based can really help prevent us to get those spikes as well, keeping our energy stable and also avoiding us from overeating maybe later. Ensuring we've got those slow release carbohydrates, food like whole grains, beans, lentils, vegetables that release energy really gradually are really important. And they really will help steady your appetite, and really help those kind of dips and peaks and troughs of your blood sugars as well. So really important to look at diet. Now, on top of that, it's really important that you do stay consistent with your injections. So keep to that consistent injection day, injections on the same day each week. It will help keep that medication at the steady levels and help build that up over time. Really making sure that we are building in those good routines. So, I mean, Dr. Matt mentioned this earlier around exercise, and it doesn't need to be intense workouts. Just be consistent with your movement. Maybe thinking about walking, doing some light strength training exercise. Not only will this support your mood and energy, it should help improve your sleep, and also will keep you active. It doesn't need to be much, 10 to 20 minutes a day, if anything makes a difference. And then I'd say really the final thing that you can do from a lifestyle is thinking about your sleep. Sleep is one of the biggest hormonal regulators that you have to yourself and helps you to control how you feel, how you interact with food for many people, and how we feel really day to day. So aiming to wind down for your routine in the evenings, having a good sleep, 7, 9 hours is really important. We know that better sleep can help us with our appetite control as well. Interestingly, we do have a webinar coming up on this with a sleep specialist as well in a few weeks, and I'll share a bit more on that in a moment. And then the final thing to say is we do have a clinical team. Make sure that you stay connected. Make sure if you have any concerns that you do let us know in your refill questionnaires, and you connect with a clinician who will be there to support you during this period of time. As like we say, we know that there are many questions and maybe some anxiety around this switch and kind of what you're experiencing. Now, I hope that we've both been able to kind of talk you through today, and answer lots of those questions on switching that we have received, and that we have been seeing in kind of our social media, in different platforms and between the community. This webinar will be available on the app in the Discovery tab, so you're able to view it in the future and come back and look at that as a resource. And then really just to say that we do have some more webinars coming up. So as I just mentioned, we do have a sleep specialist who's going to come and talk to everyone around the importance of sleep in your journey. We will be looking at how do you manage social life, temptations, thinking about the holiday period as well, and what we can do in that time. And then we've got 3 others that we've got scheduled at the moment, which is what happens when I reach my target weight. That's getting more and more in people's minds as we're seeing people progress through their journeys. And then what is microdosing and why are people talking about it? We're hearing about this more and more now, and we want to make sure that you have the knowledge and some information around it as well, as you may be seeing some information. And also what we're hoping to share with you, which we're very excited about, and when we've written it and it's all finalized, is the learnings from our study. Lots of people have contributed to this, and we'll be really eager to share those with you. So thank you everyone for joining. Thank you, Dr. Matt Noble, as well. And we hope that we've been able to answer lots of your questions. Bye-bye.
Thanks, everyone. Bye-bye.